Hi, my name is Cheryl Beckman, and I'm an RN. I've been a nurse for 30 years. I've worked in intensive care for 10. I stayed home for 9 and kept my license up. And then I went back and did floor nursing for a year and decided that I wanted to do something that allowed me to be at home more. And so I entered the home care.
Okay, so Cheryl is a private home health nurse. So Cheryl, what is your job position like? What is a typical day? What do you specifically do, and how many hours do you work a typical week?
A typical week, I work 50 hours a week, and that's by choice. But it's the same as a hospital. 40 hours would be fine. 32 is considered full-time as well. But I choose to do 50. A typical day is I enter the home, and I do work for the same family, 2 different families. But the family I work for has 2 boys who have muscular dystrophy and are on ventilators and have a lot of needs. They're trached and G buttons, and so I enter the home, say good morning, get them up, ready for school, feed them through their G buttons, brush their teeth, do all the ADLs, and then we head to school on the bus. Or if it's a day for doctor visits, I enter the van and we load them up and head to the doctor's office. I stay at school with the boys and I suction and feed them and take care of any physical needs they need, and then the teachers do the rest. Then we go home and it starts all over again with baths, feedings, medications, respiratory treatments, cough assist machines, ventilators, changing trachs, changing tubing, sterilizing equipment. And I do charting, just like everyone else. We have hourly notes that we make, and complete physical assessments with blood pressures and pulse oxes and all the equipment's there, but we're in charge of cleaning it and maintaining it.
Okay. Why did you choose this type of nursing?
I'd always wanted to do pediatrics, but I had done the hospital for so long, I decided it was time for a change. And I saw an ad in the paper and decided to apply. And I was interviewed and asked to become a nurse at this home. And I just wanted more time and just a different type of nursing from the hospital.
Okay. How much education, clinical experience, or certifications are needed for this type of nursing?
Well, as an RN, I was already trained with ventilators because I did work in the ICU and had dealt with trachs and that sort of thing, and the family needed a nurse like that. But in the home care system, there are a lot of LPNs and nursing assistants and RNs that are used. Just depends on what the doctor orders them to have.
What skills, personal attributes are more important for being successful in your job or position?
Well, you have to be quick on your feet in an emergency because you don't have backup when you're in the home. You don't have a respiratory care or a doctor at your service or another nurse to bounce ideas or troubleshoot equipment with. So you do have to be able to think quick and know your equipment, and that's kind of a different thing that from the hospital where you have respiratory care or someone else there.
Right. What do you enjoy most about your job position, and what do you personally find most satisfying?
Just watching the clients get well, being able to get out and about in the community and help the families be able to do stuff and have the nurse with them. I just enjoy just getting close with the families. You do need to be able to get along with people well and privacy and give the families what, that kind of care.
What do you enjoy least about your position?
Probably 2 things. One would be being the only nurse. I do miss that hospital companionship where you have lots of people and the excitement. So being the only nurse sometimes can be a little bit lonely, I suppose. And then the other downfall, I guess, would be that you do take sometimes a pay cut. Home care, in the type of home care I do, it depends on the level of needs that the client has and how many requirements they have for their home as to how you're paid. And so sometimes you do take a pay cut, which I did, but I was ready for that.
What's the most challenging part of your job?
I would just say being on your own and trying to make decisions without someone to, talk it over with. If the client does take a turn for the worst, just not having that backup behind you is probably the most challenging.
Okay. What advice would you give anyone interested in your field?
Oh, it's a wonderful type of nursing because you just receive a lot of gratification and you do get to become close to your clients because you are the one that's bringing them the care and the only one sometimes that they have. And so you do get to be close to other people, and I like that.
As you reflect on your basic nursing education, is there anything in particular that prepared you for your current role, like being on the clinical floor at school?
Yeah, when I was on the clinical floor, they were teaching us how to do a lot of things and think for ourselves, and I think that helped a lot. In the past, it helped me want to work in the ICU, which I did, and that also did help a lot, just being familiar with emergency procedures and ventilators and machines.
Mm-hmm. Can you provide a specific example from your practice that illustrates the importance of the role as a private in-home nurse?
Well, I think respecting the privacy of the family and trying to give them the freedom to go out and do what they need to do and be able to know that their nurse is at home with their loved ones taking care of them is probably one of the most gratifying, just knowing that I'm helping the boys to stay well and stay out of the hospital by giving them good care. It just is probably the best part of it.
Okay. And then is there anything else that you would like to share about your job or add?
Well, I've worked at the same job for a long time, so that says one thing about it. It's a great job, and just being close to the families and watching the patients grow and stay healthy and
you said
live a long, normal
one of your
life.
patients got a heart transplant.
Yep, I did have a patient that was born with half a heart, and as I've cared for her over the 9 years, she's received a heart transplant, and I've been able to watch her grow and learn and things that I never thought would happen. Mm-hmm. That's just like the best gift. So.
Well, that's awesome. Thank you, Cheryl, for letting us interview you.
You're welcome.